Have you ever brushed off a strange symptom by telling yourself, I'm just getting older? Maybe you've noticed a nagging pain after dinner. Maybe you've lost a few pounds without trying. Or perhaps your energy isn't what it used to be. Most people over 60 blame these changes on aging, stress, or an upset stomach. But what if your body is trying to tell you something far more serious? Here's a fact that surprises many people. Pancreatic cancer often develops quietly. In its early stages, it may not cause dramatic symptoms. Instead, it can produce subtle warning signs that are easy to mistake for common age-related problems. That's one reason it is so often discovered at a later stage, when treatment becomes more difficult. The encouraging news is this. While there is no routine screening test recommended for most people at average risk, recognizing unusual changes early and discussing them with your healthcare provider may help lead to faster evaluation when something isn't right. In today's video, we're going to walk through 7 warning signs of pancreatic cancer that every older adult should know. None of these signs automatically means you have cancer. In fact, many of them are much more commonly caused by less serious conditions. But when several appear together or when they don't go away, they deserve medical attention rather than being ignored. I'm Dr. Kalvin, and my goal today isn't to frighten you, it's to help you become more aware of what your body may be trying to communicate. As we go through these 7 signs, you'll notice something important. Each one may seem harmless on its own, but by the end of this video, you'll see how these pieces can fit together like a puzzle, one that could prompt an important conversation with your doctor. Be sure to stay until the end because the number 1 sign is often mistaken for a completely different health problem, and many seniors don't realize its importance until much later. Let's begin with a symptom that countless older adults experience every week, yet few would ever connect to the pancreas. Sign 7. Ongoing indigestion or stomach discomfort that doesn't improve. Almost everyone experiences indigestion from time to time. Maybe you enjoyed a large dinner. Maybe spicy food didn't agree with you. Usually, the discomfort fades within a few hours, and life goes on. But imagine this instead. You begin noticing that nearly every meal leaves you uncomfortable. There's a feeling of pressure in the upper abdomen. You feel bloated much sooner than usual. Antacids help a little, or not at all. Days turn into weeks, yet the discomfort never completely disappears. This isn't something to ignore. The pancreas plays a critical role in digestion. It produces enzymes that help your body break down fats, proteins, and carbohydrates. When the pancreas isn't functioning properly, whether because of inflammation, a blockage, or in some cases a tumor, your digestive system may struggle to work the way it should. That can lead to persistent indigestion, bloating, nausea, or a vague discomfort high in the abdomen. The challenge is that these symptoms are incredibly common. Acid reflux, gastritis, ulcers, gallbladder problems, certain medications, and even stress can cause similar complaints. That's why indigestion by itself is not considered a reliable sign of pancreatic cancer. However, doctors become more concerned when indigestion is persistent, unexplained, and begins appearing alongside other warning signs we'll discuss throughout this video. Think of it this way. Your body rarely sends just one signal. It usually sends several. The key is recognizing the pattern rather than focusing on a single symptom. If you've had ongoing upper abdominal discomfort for several weeks, despite making dietary changes or using over-the-counter remedies, it's worth discussing with your healthcare provider. They can determine whether additional testing is appropriate and help identify the real cause. And what comes next may provide another important clue. Sometimes the discomfort doesn't stay in your stomach at all. Instead, it begins traveling somewhere many seniors would never expect: your back. See, the pancreas sits deep inside the abdomen, close to several important nerves. When a tumor grows, it may irritate or press on these nearby nerves, allowing pain to travel beyond the pancreas itself. That's one reason pancreatic pain isn't always felt where the pancreas actually is. There's another clue many people don't recognize. For some individuals, the discomfort becomes worse after eating. As the digestive system becomes active, the pancreas also becomes more active, and that can sometimes make the pain more noticeable. Some people also discover they feel more comfortable leaning slightly forward while sitting than lying completely flat in bed. This isn't unique to pancreatic cancer, but when it occurs together with other unusual symptoms, it's another piece of the puzzle. Here's what makes this warning sign especially challenging. Back pain is incredibly common. Pancreatic cancer is not. That means most people with back pain do not have pancreatic cancer. Muscle strain, arthritis, spinal conditions, and other common problems remain far more likely explanations. But if the pain is persistent, difficult to explain, centered in the upper abdomen and middle back, and accompanied by symptoms like unexplained weight loss, digestive changes, or yellowing of the skin or eyes, it should never be dismissed as just getting older. Instead of trying to diagnose yourself, describe the entire pattern to your healthcare provider. Sometimes it's the combination of symptoms, not one symptom alone, that helps doctors decide whether additional testing is needed. Now let's move to another warning sign that many seniors actually celebrate at first. They step on the scale, see the number going down, and think they're finally losing those extra pounds. But when weight loss happens without trying, your body may be telling a very different story. Sign 5. Unexplained weight loss and loss of appetite. Imagine eating exactly as you normally do. You haven't started a new diet. You aren't exercising more than usual. Yet over the course of a few months, your clothes begin fitting more loosely. Friends comment that your face looks thinner. The scale keeps dropping. At first, it may seem like good news, but unintended weight loss is something doctors take very seriously, especially in older adults. Medical experts generally recommend evaluation if someone unintentionally loses a significant amount of body weight over several months without a clear explanation. Why can pancreatic cancer cause this? There are several possible reasons. First, the pancreas produces digestive enzymes that help absorb nutrients from food. If the pancreas isn't working properly, your body may struggle to digest and absorb what you eat efficiently. Second, some pancreatic tumors can change the body's metabolism, causing calories to be burned differently than normal. And third, many people simply don't feel like eating. They become full much sooner than expected. Foods they once enjoyed suddenly seem unappealing. Even small meals may leave them uncomfortable. The result is a gradual cycle. Less food, less nutrition, less energy, more weight loss. Of course, pancreatic cancer is only one of many possible causes. Thyroid disease, diabetes, depression, digestive disorders, medication side effects, infections, and several other medical conditions can also lead to unintended weight loss. That's exactly why it should never be ignored or explained away without proper medical evaluation. If you've noticed that your appetite has changed dramatically, or you've been losing weight without trying, especially if it's happening alongside persistent stomach discomfort or unusual back pain, don't simply wait to see if it improves. Schedule an appointment and let your healthcare provider investigate the cause. Because the next warning sign isn't something you feel, it's something you may actually see every time you look in the mirror. Sign 4. Yellowing of the skin or eyes, jaundice. Have you ever looked in the mirror one morning and thought your eyes looked different? Not red, not irritated, just slightly yellow. At first, the change can be so subtle that you convince yourself it's the lighting. Maybe you're tired, maybe you didn't sleep well. You move on with your day and forget about it, but over the next several days, family members begin to notice it too. Are your eyes looking a little yellow? That simple question should never be ignored. One of the most recognizable warning signs of pancreatic cancer is jaundice, a condition that causes the skin and the whites of the eyes to turn yellow. But here's something many people don't realize. Jaundice itself is not a disease. It's a sign that something is interfering with the normal flow of bile. Bile is a digestive fluid made by your liver. Normally, it travels through small tubes called bile ducts into your intestines, where it helps digest fats. If a tumor develops near the head of the pancreas, it can sometimes press against the nearby bile duct. This pressure may partially or completely block the flow of bile. When that happens, a yellow substance called bilirubin begins building up in the bloodstream instead of leaving the body as it should. As bilirubin levels rise, the skin and eyes gradually become yellow. You may also notice that your urine becomes much darker than usual, while your stools appear unusually pale or clay-colored. Another symptom often accompanies jaundice, and it can be surprisingly uncomfortable. Intense itching, not the kind caused by dry skin, not a mosquito bite, not a rash. Instead, it's a persistent itch that may affect much of the body, often becoming worse at night. This happens because the buildup of bile substances in the skin can irritate nerve endings. Of course, pancreatic cancer is far from the only cause of jaundice. Gallstones, liver disease, hepatitis, certain medications, and several other medical conditions can produce similar symptoms. That's exactly why jaundice should never be self-diagnosed. But one thing is certain: new yellowing of the skin or eyes is never considered a normal part of aging. It deserves prompt medical evaluation, especially if it's accompanied by abdominal pain, weight loss, appetite changes, or digestive problems. Doctors can use blood tests and imaging studies to determine what's causing the blockage and recommend the appropriate treatment. Now, here's where many people make a dangerous mistake. They notice the yellowing, they notice the dark urine, but they completely overlook another change that's happening every time they go to the bathroom. And that brings us to our next warning sign. Sign 3: changes in stool or urine that keep coming back. Let's talk about something people rarely discuss, even with their doctor: changes in bowel habits. Most of us don't pay much attention unless something becomes impossible to ignore. But your digestive system often provides valuable clues about what's happening inside your body. When the pancreas isn't delivering enough digestive enzymes, or when bile isn't reaching the intestines normally, your stools can begin to change. Instead of their usual appearance, they may become pale, gray, or clay-colored. Some people notice that the stool floats more than usual or seems unusually greasy and difficult to flush away. Why? Because without enough digestive enzymes and bile, the body has trouble breaking down fats properly. Those undigested fats remain in the stool, changing both its appearance and consistency. You may also notice urine becoming darker than expected, even when you're drinking enough fluids. Again, there are many possible explanations: dehydration, certain medications, vitamin supplements, liver conditions, gallbladder disease, even some foods. That's why a single episode usually isn't cause for alarm. The concern arises when these changes become persistent, repeatedly return, or appear together with other symptoms we've already discussed. Think about the pattern we've built so far: persistent indigestion, pain that spreads to the back, unexpected weight loss, yellowing of the skin or eyes, now recurring changes in stool or urine. Each symptom alone has many possible causes, but when several occur together, they create a picture that's much harder to ignore. If you've noticed ongoing digestive changes that don't seem to have a clear explanation, it's worth having an honest conversation with your healthcare provider rather than hoping they'll simply disappear. Because the next warning sign doesn't begin in your stomach at all. It begins with something that affects millions of Americans every year. And for a small number of people, it can be one of the earliest clues that something is happening inside the pancreas. Sign 2: new onset diabetes, or suddenly hard to control blood sugar. Imagine going to your annual checkup. You feel reasonably well. Maybe you've been a little more tired than usual, but nothing that seems alarming. Then your doctor looks at your blood work and says something unexpected. Your blood sugar is much higher than last year. Or perhaps you've never had diabetes before, but now you've been diagnosed with it seemingly out of nowhere. For many older adults, Type 2 diabetes develops because of insulin resistance, family history, excess weight, or lifestyle factors. It's extremely common, especially after the age of 60. But here's something that many people, including some who are living with diabetes, don't realize. In a small number of cases, new onset diabetes can be associated with pancreatic cancer, particularly in older adults. Researchers have found that some people are diagnosed with diabetes months before pancreatic cancer is discovered. However, it's important to understand that the vast majority of people who develop diabetes do not have pancreatic cancer. So, why is there a connection? The pancreas is responsible for producing insulin, the hormone that helps move sugar from your bloodstream into your body's cells for energy. If a tumor affects the pancreas, it may interfere with this process. As a result, blood sugar levels can rise unexpectedly. Sometimes people who have managed diabetes successfully for years also notice something unusual. Their blood sugar suddenly becomes much harder to control. Despite taking medications as prescribed, eating carefully, and following their usual routine, their readings become increasingly unpredictable. Again, this does not automatically point to pancreatic cancer. Changes in diabetes control can happen for many reasons, including infections, stress, certain medications like steroids, hormonal changes, or progression of diabetes itself. But when new onset diabetes or unexpectedly worsening blood sugar appears alongside unexplained weight loss, persistent upper abdominal pain, jaundice, or digestive problems, healthcare providers may consider whether additional evaluation is appropriate. This is exactly why routine medical checkups matter. Simple blood tests can sometimes reveal changes long before a person feels seriously ill, and while those tests cannot diagnose pancreatic cancer on their own, they may provide important clues that deserve further investigation. Here's something worth remembering: your body rarely changes without a reason. If your blood sugar suddenly behaves very differently than it has for years, don't assume it's just bad luck or getting older. Ask questions. Share every new symptom with your healthcare provider. Sometimes the smallest detail can help complete the bigger picture. Now we've reached the final sign. Ironically, it's also one of the easiest to dismiss. People blame it on retirement, poor sleep, stress, a busy week, or simply getting older. But when this symptom appears together with everything we've already discussed, it can become another important piece of the puzzle. Sign 1. Persistent fatigue that doesn't improve with rest. We've all had days when we felt exhausted after a long trip, a sleepless night, or a particularly stressful week. Usually, a good night's sleep helps us recover, but this kind of fatigue is different. You wake up tired, you stay tired throughout the day. Even simple activities, walking to the mailbox, preparing lunch, or folding laundry, feel more draining than they used to. A nap doesn't help. Going to bed earlier doesn't help. The exhaustion simply lingers. Why can this happen? Serious illnesses, including pancreatic cancer, may place enormous demands on the body. Inflammation, poor nutrition, unintended weight loss, changes in metabolism, anemia, and the body's immune response can all contribute to ongoing fatigue. But it's important to remember that fatigue is one of the least specific symptoms in medicine. Heart disease, thyroid disorders, depression, sleep apnea, medication side effects, vitamin deficiencies, infections, and countless other conditions can also leave someone feeling constantly tired. That's why fatigue alone should never be used to diagnose pancreatic cancer. The concern arises when persistent fatigue develops alongside other warning signs we've covered today. Perhaps you've been losing weight without trying. You've noticed stomach discomfort after meals. Your back pain doesn't seem to have a clear explanation. Your urine or stool has changed. Or your doctor has recently found unexpected changes in your blood sugar. When several of these symptoms appear together, your body may be signaling that something deserves closer attention. The goal isn't to panic. The goal is to act. Because early medical evaluation can identify many different health conditions, some serious, many treatable, and the sooner you understand what's causing your symptoms, the sooner appropriate care can begin. In just a moment, I'll bring all 7 warning signs together and share what you should do if one or more of them sound familiar. That final takeaway may be the most important part of this entire video. We've covered 7 warning signs today. Let's quickly bring them all together. Persistent indigestion or upper stomach discomfort that doesn't improve. Pain in the upper abdomen that may spread to the middle of the back. Unexplained weight loss or a noticeable loss of appetite. Yellowing of the skin or the whites of the eyes. Ongoing changes in your stool or urine. New onset diabetes or blood sugar that suddenly becomes difficult to control. Persistent fatigue that doesn't improve with adequate rest. Now, here's the most important thing I want you to remember. None of these signs by themselves prove that someone has pancreatic cancer. In fact, most people who experience one of these symptoms have a completely different, and often much less serious, medical condition. Gallbladder disease, stomach ulcers, acid reflux, diabetes, liver problems, medication side effects, and many other conditions can produce similar symptoms. So this video is not meant to help you diagnose yourself. Instead, it's meant to help you recognize when something unusual deserves a conversation with your healthcare provider. One symptom may not mean much, but when several symptoms begin appearing together, or when a symptom lasts for weeks without a clear explanation, that's when it's time to stop guessing and start asking questions. Many people delay seeing a doctor because they don't want to overreact. They tell themselves, "It's probably just my age. It'll go away on its own. I don't want to waste anyone's time." Those thoughts are understandable, but they can also delay the diagnosis of many medical conditions, not just pancreatic cancer. Your health is never a waste of your doctor's time. If something doesn't feel right, speak up. Describe all of your symptoms, even the ones that seem unrelated. Sometimes it's the combination of small details that helps your healthcare provider decide what tests, if any, are needed. And if pancreatic cancer is ruled out, that's good news. You'll still have taken an important step toward understanding what's causing your symptoms. Remember, the goal isn't to live in fear. The goal is to stay informed, pay attention to your body, and seek medical advice when changes don't make sense. If you found today's video helpful, consider sharing it with a parent, spouse, sibling, or friend over 60. One conversation could encourage someone to seek medical care sooner, and that could make a meaningful difference. If you enjoy evidence-based health information designed specifically for older adults, don't forget to subscribe and turn on notifications. Every week, we share practical tips to help you stay informed, protect your health, and make confident decisions as you age. Thank you so much for watching. Take care of yourself, stay curious about your health, and I'll see you in the next video.